the velocity, we brought up a new thing which was called as duplex sonography. Now, as the name suggests, duplex, it means it is something which is double. So what is double in duplex sonography? In duplex sonography, we have a combination of beam mode sonography and we also use continuous wave Doppler. So how does it help us? Now, in this situation, what we do, first we get a beam mode sonography image of an area of interest. So let us suppose that this is the beam mode sonography area where we are interested in. In this particular area, you might have the artery or the vein or other vessel of interest, whatever you're trying to image. Now, we have already discussed that now we are using a continuous wave Doppler. So this particular element is the one which is transmitting. And let us assume that this particular element is the one which is receiving the sound waves. Now, once this entire process occurs, we know that there is an area which is the sensitive area where you can get the pulses from. So I can draw a line and this particular area can be sampled by my continuous wave Doppler and it can tell me about the velocity in this particular range also, because now I know the depth. When I know the depth, I can calculate the velocity. Fine. That is true. We can again use the same equation, speed is equal to distance upon time, and we can calculate the velocity in this particular area. But there is a problem. There are two vessels which are closely spaced to one another. We've talked about this before also. If you have an artery and if you have a vein, then in this sensitive area, you're going to have both the artery and the vein. So you would have signals which are returning both from the artery and the vein. The artery would show a very good amount of flow. The vein would not show good amount of flow. It will show a slow, non-pulsatile flow. So what you will have in the end, your transducer is going to get confused because it is getting signals from both artery and vein, and thus it cannot accurately tell you what the velocity of the particular vessel at the point of interest is. Okay, so this is going to be one major problem with a duplex sonography as well. The only way in which we can solve this problem is somehow if we can actually isolate these two, artery and the vein. I mean, if we can isolate the signal from the artery and isolate the signal from the vein. And that we can do only once we know what the depth is. Because if you know the depth of artery and that of a vein, then you can obviously take signals or take Doppler signals from the artery and the vein separately. But don't get confused with this duplex sonography. Here also we are looking at an image of artery as well as the vein. On a B mode sonography, we're getting an image. We don't know what is artery, what is vein, because on B scale or a B mode sonography, you cannot tell exactly. However, when we're taking the signal, that is a Doppler signal, you're taking it all throughout this particular length. Entire length is being used for getting a Doppler signal. So you actually don't know where this signal is coming from. You will get the signal, you get the velocity also, but you would not be able to tell whether this velocity is from the artery or from the vein, because that's the image that you've taken of the B mode is going to be static, and the velocity measurements that you're going to get are going to be dynamic, and they're going to be a summation on both the artery and vein. So this is a major problem with duplex sonography. However, in duplex, we're using both the combination of a B mode sonography and a continuous wave Doppler. Problem is the depth is not calculated, and as a result, the signals from the arteries and the veins, particularly when they're lying in close proximity to each other, cannot be isolated. So let's come to the solution. Get a solution of this thing, we need to get an idea of depth. Fine. Until unless we know what the depth is, we cannot isolate signals from two vessels which are lying in close proximity to each other. And how can we calculate depth? We've talked about this many times, that to calculate depth, we would need a receive time. We would need some time, a pause, in which the transducer first sends an impulse and receives the impulse back, so that it can actually calculate what the depth of the tissue is, keeping into mind the speed is 1540 meters per second, okay, or the sound in that particular tissue. So it can calculate the depth of an individual organ, and it can actually plot it on the screen as well. So how to measure the depth? Now we've talked about this, that whenever you want to measure depth, continuous wave Doppler is going to be no use to us. We would be needing to send pulses, and we'll need to give some time for the ultrasound beam and the transducer to analyze the returning ultrasound waves, because only once it analyzes the time which is there between the incident and the received waves, it can tell us about the depth of a particular organ or a particular tissue, and the same can be plotted on a beam mode sonography image. So it means that, in other words, continuous wave Doppler can never give us an accurate measurement of a velocity of an artery or the vein. For getting an accurate measurement, we'll have to shift our technique. We'll have to do something else. We'll have to add a pulse mode sonography. So what is pulse wave Doppler doing? It sends short pulses of ultrasound, after which there is a receive time. The time is given for the ultrasound beams which are reflected back to get transmitted into the transducer, and the transducer will take time to analyze them. So we have to analyze the sound waves between the pulses. Returning signal is required after a certain time, after which the pulse is transmitted. That is what we've already told. And thus we can actually calculate the depth.